And thank you very much for joining us here on PM Express tonight. A conversation that we can no longer avoid, which is election 2020 while living with the virus, the post-COVID reality. The key question to ask tonight is this question. 6 months to the December 7 elections, but will the elections be held within the climate of COVID-19? And there's an answer to this that the information minister articulating government position has already provided as far as this is concerned, and that whatever happens, the elections on December 7 must happen. That is a government official position. And if you look at the trend in terms of the public view on living with the virus generally, there appears to be some agreement with a particular position as well. Now, social media polling that we've done show that there is general acceptance that life must go on while living with the virus. I want to show you what the poll results tell us on PM Express tonight. And this is something we did on Friday for Ghana Connect. And it showed, the question we asked simply was, and this is the Facebook one, right? We asked, the government has invited a national conversation on living as normally as we can while the virus remain in the global ecosystem. Are you ready to live your normal life with the coronavirus as restrictions begin to ease in Ghana and across the globe? Now, if you could look at the total number of votes, we have the 4,600 votes. That's quite a significant number of people participating in the polls. 56% says yes, they are ready to live their normal lives with the coronavirus restrictions as it begins to ease in Ghana across the world. They are ready to live their normal lives with the coronavirus. They're ready to do that whilst the coronavirus is still around. And 44% say no, they are not ready with living with the virus. That tells a story. And this is on Joy News. If you look at Twitter, a similar percentage also plays out also on Twitter. You see on Twitter, similar, that the yes, I'm ready to live is 57.3%. Just around the same margins as we saw on Facebook, saying they're ready to live with the coronavirus whilst it's still within the ecosystem. And no, I am not ready is 42.7%. And so at least for those who participated in this social media polling on the two social media platforms for Joy News, the majority are ready to embrace life as close as it is to what they've known before coronavirus and live with it. Of course, within the protocols as we've come to know, either social distancing or wearing a face mask, people are anxious to go back to the life, something close, something akin to what they knew before coronavirus struck. And clearly, the election is one of them. Before coronavirus, we would normally have elections. We take it for granted on December 7th that it will happen. Now people are thinking, okay, what should we do? If you follow what the polling is telling us, people really want to get back to doing things, including the elections. The key question will remain that what do you do to have the elections safely in the context of COVID-19? That is a big question to ask now. So if people are ready to live with the virus and also, of course, embrace the thought of having the elections on December 7, the big question is the question you see here, what it would take to do it safely in the context of COVID-19. Now, a bit of research will tell you that some countries have already gone ahead and have held elections within this current environment. Let's go through a bit of that. In the United States of America, in a state called Wisconsin, they held their primary on April 7. And as you can see, the picture tells its own story, right? The picture does. You see the distance in there. This is a polling official you see in this picture, completely dressed in the personal protective clothing, with face mask, with goggles, completely PPEs in full regalia there as he polices the poll. And you can see the space in between one booth and the next. A total of 6 feet is what they were using in Wisconsin when they held it in April. And so clearly lessons there that if you're going to hold it in Ghana, we have to give this sort of PPE to our election officers who will be at the polling centers. So this is the case of Wisconsin, right? Let's come to West Africa. In West Africa, Mali also held a general election, just as what we are talking about tonight. Again, within the COVID-19, period. And this is just in March, by the way. And it was pretty successful from what we hear from the monitors who were there. People were social distancing. Now let's go to South Korea. And South Korea did this, I think, the most successful so far if you read the literature. And as you can see, again, social distancing being observed in the booths. The picture tells its own story. And in South Korea, they did something very interesting. In fact, everybody who showed up at the polling center was screened with the temperature gun. If you have temperature above the threshold, you are then taken out of the queue and sent to a particular designated booth for people who may be suspected coronavirus cases. In fact, for those people who were coronavirus patients, they had a separate polling arrangement for them. And they held this particular elections fairly recently, also in April, just last month, while coronavirus was at this peak in that particular country and across the world. So what does this show us? That we can do it, but there are challenges. One of the key challenges, as we've seen in the United States, is that after the elections in Wisconsin, they found that 19 cases of coronavirus were later connected to the primary elections that they held. And so it is not without the risks. It's a question of managing that risk, as the Wisconsin scenario is teaching us here. So how do we conduct the December 7 elections safely while living with the virus? Another question to ask is, what will the campaign look like? A very important question. Will people go out there and do rallies? If you don't do rallies, then how do you sell your candidate and sell your message? We're going to be speaking to the two main parties, but also we're going to speak to an expert, because we will need all of them together to make a decision about the best way to have the December 7 election. Stay with us here on PMX. It's a fascinating conversation about to ensue. And thank you for staying with us here on PM Express. And my guest joining me all via Zoom tonight is Information Minister Kojo Oppong Nkrumah. Also joining me from the NDC is former Health Minister, Mr. Alex Segbefia, who is also a member of the opposition party's COVID-19 team. And I'm grateful, Mr. Alex Segbefia, for joining us here on PM Express again. And I'm also delighted that we could also speak to the expert on this particular matter, Dr. John Amoisi, who is a public health expert. He is also Global Health Department of the KNUST and a group leader of the Global Health and Infectious Disease Research Group at the KCCR, one of the testing centers for the coronavirus. And I want to start with you, Dr. Amoisi. Simple question: can we hold the December 7 elections with coronavirus still around?
No, thank you very much for that question, and my greetings to the esteemed panelists. I'm very pleased to be in very good company this evening, and of course to your listeners. The question you've asked is really critical, and to some degree you have provided an answer to start with, because you've demonstrated that it can be done elsewhere. I was listening carefully to your rendition, introduction, and I thought that was very erudite indeed, because you've almost, I don't know what other questions are left for us to answer, but it is clear that all things are possible. Where there is a will, there is a way. There's a way things should be done. So if you ask me for a very straightforward answer, I would say that yes, it is possible, but it is dependent on certain factors. And I'm sure that this evening our discussion is going to get into that.
Exactly, exactly.
Short answer is yes.
Yes. Possible. Okay. So that's why we have you, because we're going to go into, so what would it take? I've of course illustrated that it can be done elsewhere, but Ghana has its own peculiar, I guess, situation, and that we probably have to adapt. And so I will come to you to tell me how we could adapt and what it would take. But let me go to Mr. Segbefia. Mr. Segbefia, that same question to you. I mean, that's the expert view there, that it's possible. Of course, but we're dependent on which other measures you put in place. What do you say? Hello, Mr. Segbefia.
I'd muted my phone. I apologize.
Yes,
Good evening.
we could hear you, yes.
All of you and my co-panelists, Dr. Amuasi.
Yes.
And obviously, my brother Kojo Obon Nkrumah, who every time I look at him, my eyes hurt me because of the elephant behind him. But
that's a good one.
But having said that, I would first of all say that, yes, we have to do everything possible to have the election on the 7th of December. And it can be done. And we have to put steps and measures in place from all the experiences of other countries to ensure that we have the 7th of December election, because if we don't, based on the constitution we have, I think that we're going to run into some serious constitutional difficulties if we don't have the election.
Okay.
So a short answer is yes. But can I just add now, since we're in the debate, or add a few points? The problem we have is that if you look at the lead up to the election, if the election was the only issue we had to contend with regard to protocols and social distancing, which is definitely a requirement, we wouldn't have too much of a concern. Our concern is because there are 4 separate incidents that are going to require us to actually congregate and technically put Ghanaians at risk on 4 separate occasions. It's not just the one. The first is when the 3 million people who have registered with the national insurance card are going to pick up their cards. And that is a whole process in itself, because they have to go through verification. So whatever process you outline in terms of PPEs for the people who are going to see them, and face masks and all the things all the protocols have to be conducted when 3 million people are going to get their cards. Then you have almost 5 to 6 million people who haven't yet registered with the NIA and are going to try and register during that period, because they need the national or the Ghana card to, along with the passport or 2 other people, you need that requirement based on the CI that people are waiting, or that has gone through Parliament, to actually be in a position to register. So you have a second issue of people going through what is a very, we say, dangerous procedure, while we are having the discussion on just the election. Then after that, you're going to go through 17 or 16 and a half or 17 million people going to go through a registration process before you get to the election for the 17 million to go and vote. Now, for some of us, just looking at the end product without seeing what is going to come before, in terms of risk factors to the Ghanaian people, my view is simply that if you immediately go and the EC is listening and they decide, look, we will deal with the old register, and that will mean that all the first 3 issues I have raised will not arise. And let's concentrate on how we are going to deal with the 4th matter, which is the election. A lot of risk would be taken away from the Ghanaian people, and we wouldn't have, for what is a very infectious disease, which has been shown to be seen to be going and then come back again, we wouldn't have gone through that risk factor. So that is my initial point.
Okay.
We should have the election. We should concentrate on that. this issue of the new register is going to open a can of worms, and we will be doing an exercise which we're already thinking about, which is difficult, in December, three times before we get there. And by that time, if you're not careful, it will be out of hand.
Okay. I mean, Mr. Oppong-Nkrumah, what you say to that, base question? We've heard the expert, we've heard the NDC view. What's your view?
So, Evans, good evening to you, to Dr. Moisi, and to Alex, and to your viewers as well. I think all three of us agree that if you look at our Constitution as it's written now, the combined reading of Articles 66.1 and 66.3, without an attempt to suggest that we should have an intervening period, during which period we are doing something else that we all don't know, brings us to one conclusion and one conclusion only, that the December 7, 2020 election must take place. Now, in the computation of the world's activities, I think since December last year, and in recent months, one thing that has come to the fore is the need to adapt to a certain new normal, or a certain new reality, which is that the COVID-19 or the SARS-CoV-2 virus is in the global ecosystem, and therefore everybody has to find a way to adapt, protect lives, and still manage to have normal processes like our elections go on. And you are right. Burundi, Benin, Korea, South Korea, Mali, and other places have demonstrated that you can adapt and put in place the necessary preventive or protection layers and still go about your national election. Now, what I hear, for example, my good friend Alex says that there are about 4 risk levels herein. If you look at how Ghana's Electoral Commission is sounding that it wants to go about this election, and that he will prefer that the first 3 risk levels are eliminated so that you just go straight into the election without more. And if I hear Dr. Moisi right, he's also suggesting that, yes, where there's a will, there's a way. And if you are minded to, you can find a way to do this while protecting the population. I think for me, the position is quite simple, or for the government, or for the administration rather, the position is quite simple. Yes, the election must come on. Yes, we must find ways of adapting, but we cannot use the election as an excuse to jump some of the steps or the rules or the mandates as exist in the books. What we need to do is to confront the beast in the room, just like Alex is suggesting. What are the risk levels? But what we don't need to do is to jump them, but rather to decide how to mitigate or to protect against those risks. Because invariably, even if you said you wanted to go ahead with the election without a new register, as the EC is suggesting that it wants to do, you will still need to register persons who have turned 18 this year. It brings you to the same question of risk, albeit with different numbers. When you are done, you still need to do an exhibition exercise of some sort, which still brings you to the same level of risk, in which case even the risk is not, may I say, altered or mitigated, because it's everybody who's on the roll who's expected to literally go and participate in that exhibition. So the risk levels will still be there. My view, what we need to do is to find ways to mitigate, find ways to protect the population while we are doing so as political parties, as the Electoral Commission, and as other stakeholders in this process. And if you're following, like you alluded to earlier, what Korea has done, what some of the other countries has done, there are ways by which, even for COVID-19 positive persons, countries have shown that they can find ways to let them vote so that they are not disenfranchised, and that in the end, the sovereign right of the people will not be inhibited in any way, and at the same time, unnecessary risks will not be elevated to some levels.
I'll come to Dr. Moisi shortly, but let me quickly run something by Alex based on what Kojo had said. Mr. Segbefia, so Kojo says, even if you're doing limited registration, which is almost a mass before the election, because people have turned 18, they are dead people, you want to take them off the list, etc., and you want to get them on. Even if you're doing that, that still is a risk that you would still have to deal with. Even if you're not doing an entirely new voters register, people will still have to congregate for that to happen, and then you have to do exhibition. People have to show up at the at the polling centers to check that their names are in there. So what you make of his point that the most important question to ask now is how do we limit the risk, and not necessarily how do we eliminate the other procedures leading to the elections?
I do not believe that the risks that we are talking about are in any way equatable to what I have narrated. If we don't have a register, we go by the old register. Fortunately, because we had a limited registration last year, I think September, October, because we were going into the new register, the total number of people approximately who, according to the statistical service, is around 600,000 people. So our debate is on 600,000 people to go and do a limited registration. How does that compare to 17 million people going to register on a new register completely again? The comparison is non-existent. And you're talking about first 3 million people, then 7 million people, and all this is being done in a rush because people with national insurance cards, Ghana cards, have to have them in order, apart from, passports, and the passports and 2 people vouching for them, it's not what people will be looking for in the immediate this thing. They would love to get their cards. So you would have 3 million people is a lot of people queuing. Even when you were just doing the limited, getting the people trying to register in Eastern region, you saw the backlash. You then have another 5 million people who now have to actually go and register completely because they haven't got cards at all, or approximately that, before you get to the 17 million. If you were, and then with that, he's now added even another factor, because assuming we wanted to go down with this thing, analogy, then it means that the exhibition is going to let another 17 million people go out there. But I don't take that analogy, I don't rate that too much, because in actual fact, the exhibition is not patronized by a lot of people historically. It is hypothetical. In other words, it's there, people have the opportunity to go, but a lot of people do not actually go and check whether their names on it. They assume their names are on the list. So you will never get those numbers or those problems in actually, and I'm now being practical in that type of a scenario. But the other issues I have raised will happen. And it is underestimating. You see, if we didn't have another register, or an old register, none of this would be an issue. But we do have one, and it beats me as to why we give ourselves the risk of going through these processes. Because COVID is dangerous, COVID is real. And even though we know that we need to have the election, we must be seen to do everything to mitigate the ability to spread this disease. Even after the election, if we are in the wrong place with the election, numbers will go up. But one can understand why the election must take place because of the constitution we have. So that's where we are. I don't agree necessarily with the explanations that have been given. If anything at all, I took them at face value. It actually makes the situation worse.
Dr. Amoisi, so let's come to what the science tell us. So if we must have it, and people will congregate, millions of people will have to congregate to register, how do you do it safely?
Well, thanks to that question, Evans. I've just been listening carefully to the submissions from Mr. Segbefia and Mr. Kwame Nkrumah, and I totally see, the conundrum in here. It's important to really understand my position when it comes to this in the light of being a health professional. And you've got to understand my bias, that I'm looking at things strictly from the health perspective, which is why I think you asked me to be on this program. For me, it's less of the election must happen and more of the election can happen. And this is what I said right from the beginning, which I think is a little different from what Mr. Segbefia and Mr. Kwame Nkrumah are saying. I think they both agree that it must, all right? I'm not going to go there. I'm just going to say it can. happen. So it is possible.
Okay.
So, and we all agree that there are issues involved and the risk is there. Anytime you have people traveling and then people gathering, it is actually an explosive mixture, because not only do you have them congregating, but you have them, coming from places, mixing together, and then going back. Now that in itself is the activity itself is analogous to an explosion. You see that movement is an explosion. So there is an inherent risk. Now this inherent risk, it will be a function of, to be less technical, maybe I should backtrack a bit. It's really contingent on what we would call our reproductive number. And I keep coming back to this reproductive number. It's a bit technical, but it's really important we keep harping on this, because
that is what you call the
really
R.
where the rubber hits the road. And it informs you as to whether your risk is worth it or not. Now, I was explaining the other day on Saturday that if you have a reproductive number that is below 1, you are normally happy. This means the infection is still present, it is still spreading, but it is not exponential. It is not getting out of control. So if you have, say, a reproductive number of, say, 0.5 or 0.6, and by increasing levels of interaction, traveling, and interaction and movement, you're going to move this up to, say, 0.8. Yes, there is risk involved. More people will be infected. There may be some death. But the argument is, you may say, well, we can stomach this. We can take this. But if you have something like 0.6, and then your activity is going to move you through to about 2 or even 3, that certainly you do not want. And if you ask me, I'll tell you point blank, it's not worth it. All right. So that's why I say it is, yes, it can be done, but it is contingent on us having a clear understanding of where we are with the infection. Now, it becomes a bit tricky, because if you look at the data from all over the world, you can see some countries who put in measures late and did not suffer very badly. Some countries put in measures late and they suffered really badly. There was one country in South America that put in measures very early, and yet they've been very, very hard hit. They literally closed their borders, did everything right, and it didn't go good for them at all. It tells you that there's a lot that we're still learning from this epidemic. And I was on calls today with colleagues from all over the world, from Southeast Asia, from the UK, from the US, just discussing some of the clinical research around the virus. And the one refrain that kept ringing through is, we don't know, we don't know, we don't know. And right now, we don't know how it is panning out in Africa. I can tell you that in the Indian subcontinent, in India and in Pakistan, it started very slowly, like it did in many parts of Africa, and is only now beginning to accelerate. Now, it's difficult to tell whether we have the same situation in Africa, although arguably it looks like it's been consistently slow in Africa. My argument would be, don't we have a point at which we can all say that beyond this point, no more, we're calling it off? And of course, if you're calling it off, it means that you've got to put in place some measures. Now, these are not measures you can put in place just, at a whiff. It means that if there are contingency measures, we need to start thinking about them now. The two parties would need to start agreeing on them now. And this is my position as a health professional. I realize it's sort of a wish list of what, as a health professional, I would like and I think should be done, but it's more difficult. It's easier said than it is done. So yes, there is inherent risk. That risk must be measured. It can be modeled, but of course, models are subject to many things. And I think one of the first things we should do is to subject this to modeling. What if we have a certain level of aggregation? People traveling from all over, taking into consideration the number of cases we have in various regions, mixing over a certain period of time. Then when you look at what that model gives you, it can then inform you as to whether you would want to even increase the number of days over which the election takes place, whether you want to increase the amount of social distancing, whether you want to include, giving out free masks to everybody who comes to vote, it will inform you as to what measures you put in place and how those could impact on the outcome. But what I would really love to see as a health professional is a point, a line which we would draw and say, beyond this, no, it's not worth it. And for even, if possible, both parties to agree that beyond this, no more. That's what I can say for now.
I'll come to you, Dr. Amoeksi, because I want us to also walk through specifically what it would take from a public health point of view to do it safely. Whether we can bullet some of the key issues for me. But Kojo, your reaction to all that?
No, I'm in total agreement with him. What we need to do is to see the Electoral Commission roll out in detail what their proposal is. We have a very interesting constitution here in Ghana. I think if you read Article 46, the Electoral Commission, at the end of the matter, is the independent body that, in fact, if you read Article 46, if you just permit me, except as provided in this constitution or in any other law not inconsistent with this constitution, in the performance of its functions, the Electoral Commission shall not be subject to the directions or control of any person or authority. So in the end, they will be telling us what it is that they desire to do. But whatever they desire to do must make legal sense and must also make sense when you compare it to what we call public policy. Now, it therefore gives us room that whenever the EC is saying anything that doesn't make legal sense or doesn't conform to public policy, we can go to the apex court of the land and have some intervention. Until then, the EC will tell us what they need to do. And we all need to, perhaps push and ask the EC to roll out in detail some more already what their plans or prescriptions are, because the reality is that COVID-19 is going to be out there by December. We're going for elections. Even prior to December, some of the processes that they need to roll out. So whether we know our R or we don't know our R, we still need to start having a rollout of some of these details so that all of us can interrogate. What I do not subscribe to is a blanket taking off some elements off the table, even before we have gathered all of this kind of data. And as the EC rolls that out, we can then have an opportunity to interrogate and say, this may not be enough, maybe we could do a bit more, or, well, considering this poses too much risk to us, or that. But as it stands now, I think the general consensus that we can come to is that, yes, the election must take place. Yes, we need to adapt and come up with some measures. And like I said earlier, the processes and the rules prior to the election cannot be jumped because of convenience. We need to engage and see what the prescription is. And already the ECs, if I've seen them advertising, if they want to go ahead with the registration, they are advertising some preventive etiquette for this potential registration exercise. What we need to do is now to examine, are these preventive proposals they are putting on the table enough, or will we require some more? I think today, if I'm right, the EC called an IPAC meeting, I suspect ostensibly to discuss this and a few other matters. I haven't spoken to our party's general secretary. I don't have a brief on the outcome. But I think it stands to reason that these are some of the things that should be tabled there so that parties can interrogate it and help the EC come to a certain view that this is enough, or maybe we need to step up the preventive pass a bit more.
Yeah, I mean, and just before I come to Alex, it's clear that whatever measures we introduce because of COVID-19 so we can accommodate the elections will cost us quite a bit. And remember that AC had sent in their budget before all this global crisis hit. In the US, the modeling that has been done show they're estimating that it's going to cost them excess of $2 billion. And this is work that was done by the non-partisan Brennan Center for Justice. They released a detailed plan to protect the 2020 vote during the pandemic. And they estimated they will need $2 billion just to fund all the changes that need to happen so they can have a safe elections on November 4th. Is government prepared for that sort of expense, knowing that we've already budgeted for money to the EC, not factoring in COVID-19, but here it is. What's the thinking there?
As I mentioned earlier, that is why the EC will need to come to the table with that exhaustive list of things that it needs to do to mitigate against the risks of COVID-19, so that we can have a conversation and take an informed decision. Why in the US are they able to already point to a figure of about $2 billion and then have a conversation about whether or not the Treasury can afford it or whether or not it is worth it? It's because that kind of analysis is beginning to take place. And so for me, that's where we need to go, so that the EC comes to the table, whether within their current budget they can fund the contingencies of a COVID-19 mitigation exercise, or they'll require extra funding for saying they need to step up to the plate ASAP, so that as a country we can engage based on the facts as they put it on the table and make a decision on the path forward.
Mr. Segbe, a fair point?
Well, I think that when it comes to the funding, there are some issues that have to be looked at. But I think let me start from the narrative. You have to understand that as a political party, even before COVID, we had raised certain concerns about the EC's ability to conduct a full registration process in the time that we had. We went through and we had civil society organizations, other institutions kept questioning even the process, why it had to be done, etc., etc. You then had an act of God, and I mean it in the terms of nothing to do with political parties or anyone else. COVID arrives. And COVID has already taken out 3 months, going towards 4, of any planning process that was going to be done in normal times. And we all know that elections in Africa are the most volatile period for any country. And so you try to reduce that. So for me, it begs belief that we're all talking about COVID now, as if all the issues that were raised already against the issue of a register have evaporated. They haven't. Those issues exist. The timelines, whether we are going to be able to do it properly, and COVID has now come to add to it. So when you look at it from that angle, why is it that we are always rushing? Now, if you wait to July or August to decide that, look, based on everything that has happened so far, it is time now for us to consider using the old register. You're still now going to start rushing that one. And that is, for me, going to be a travesty, because we would have lost a lot of time. Put that aside. You're talking about costing. The government had indicated before COVID that possibly for the first time, we were not going to have any funding from donors for our election. In the past, we've had some donor funding. For the first time in this election, the government decided that we're going to have a new register. We will fund it all ourselves. And now COVID has come on top of it. So the expenditure is now going to go up. Prices and the ability to do things in a shorter space of time means that you lose any economies of scale, and in actual fact, prices are going to go up. So any way you look at it, the cost of the election will become more expensive. Add on to that, new register expenditure, new NIA cards to be done expenditure, all that, which is in the budget. But so I always say that the fact that something is in the budget doesn't mean the money has reached you. You have your wish list, you have what they read in the budget, and then you actually have what money actually arrives. And this money was based on a budget where people expected to make a certain amount of money during the year. That money is not going to come because we are not getting the revenues. Our finance minister has told us. So it's a very difficult year. Why are we doing this to ourselves? So no, I think that there's a valid question you've asked about funding, Evans, but I think the government is going to end up in a lot of difficulty. And with one stroke, one simple decision, which I'm hoping our brothers in the MPP will come to us and say, look, for the sake of our health, we don't need multiple positions where we are all going out to queue and register, get our cards, vote. Let's put that aside. Let's give the EC enough time to get whatever they need to get the old register up and running, and let's work with that. For me, it's simple, difficult, and in any event, people say get used to COVID. Dr. Amusi, one of the things I would say is that nobody is sure about COVID. But the one thing we are hoping, like many diseases in the world, is that one day we'll get a vaccine. Mm-hmm. And people have said between anything from a year to 18 months, 2 years, you'll get a vaccine. That is the belief. It may disappear like SARS. We don't know. The view is that it may not. Some say it will. since we don't know what will be happening in 2021, 2022, your guess is as good as mine. But it gives the EC, the National Health Identification Authority, enough time to register people, give them their cards. There is no pressure of an election. And nobody is going to dispute that. Why are we fixing all this into 6 months? And that, for me, it's not about politics. It's about the health of Ghanaians and the running of a free, fair, credible election, which all parties to it, namely the opposition, will be satisfied with. If not, regardless of the outcome that comes out, you are going to then get into the difficulties that exist with elections, notwithstanding COVID-19's case. And I think that's a very important point.
Yeah.
But I know Kojo will have a different view.
Kojo, because it's mentioning your name, you want to quickly give me your thoughts on that, and then I'll bring in Moisi to wrap up, because he needs to leave us.
Alex, likes to needle me to get my views on some of these matters. But just a few quick reactions. First is the suggestion that it is obvious that government will have lots of difficulties in funding all of these processes that may be simultaneously going on. Our democracy is expensive, and that is why it's important that as early as possible the details are put on the table so that we can examine it and then do so. If we are to use the cost of items to now begin to do away with some of the constitutionally mandated things that we have to go through, I'm sure a lot of other arguments can be made. But that also brings me to my second point. We're a nation of laws and not men. These are constitutional matters that we are talking about. The issues of, for example, even the register, the issues of exhibitions and things that come along with it. They are not things that can be, may I say, wished away for expediency reasons. So I hear Alex and some of those who argue that why don't we just find a softer way out of this? But these are constitutional matters. You just don't find a softer way out of things. Because even if you attempt to do, the EC could be subject to several pieces of litigation that they're actually going contrary to what the CIs and what the Constitution lays out for us to do. So without going round and round in circles, a few things that we need to go over and over again. Number one, the EC will decide in the end what needs to be done. If we're of the view that what the EC is saying doesn't make legal sense or doesn't conform to public policy, like some of the arguments that my good friend Alex is making, there is a good avenue to get that vacated, and that will be in the courts. In the absence of that, like what every other country is doing, what you really need to focus your energies on is how do you mitigate the various risks along the way. And I think that the earlier we start putting our energies into that exercise of mitigation of the risks as against some of the, may I say, re-engineering of the old issues against the EC's position, which issues can best be ventilated in the courts for a proper decision to be made, the better we will be off.
I mean, Dr. Moisi, so tell me this. Assuming EC calls you and say, we want advice on how to safely conduct the December 7 elections so that we mitigate the risk, so we don't spread the virus even further. What would you advise them? What steps would you give them in terms of how they go about it, doing it safely? What should they be considering? What should they be doing? Hello, Dr. Moisi. I think you've muted.
Yes,
I can hear you. I can hear you now. Yes. Great.
No, thanks for that. We're totally enjoying the debate, listening to both sides and the arguments that are being posed. And I realize that, from a medical or public health perspective, there's a lot of common ground across the board about the risk that is involved generally in gathering and traveling, which is what electioneering involves. The challenge is with how much weight is put on these risks. And while this weight has an intrinsic value, which those of us in the public health, the global health sector can provide, the ultimate weight that is assigned to these risks is colored by special interests. And special interests will always vary across the board. So what I will always do is to present to you the intrinsic weight, and whether the pendulum will swing to the left or to the right is out of my purview, as you know. That being said, if we should be going ahead with this, and I'll explain why I say if we should be, then we need to put in place various measures. And I realize that the EC has already outlined some very clear steps, most of which I'm just going to reiterate. The idea of the mask wearing is one of the most powerful things that can be put forward. And this is why when you asked me earlier, I suggested that considerations of giving out free masks should be made, and the necessary cost implications certainly should go in there, because the mask reduces the risk of transmission. Now, when you combine mask wearing with hand washing, sanitizer use, and social distancing, it's a very, very powerful tool. Any one of them taken out of the equation substantially reduces the overall benefit, or increases significantly the risk of spread. They have included things like temperature measurement and temperature scanning. It is a very relatively poor measure of risk, because an increased temperature can be caused by many things. And the argument would be that if you check temperature and it's high, are you going to exclude an individual? My suggestion would be that if you check someone's temperature and it's high, then you may want to give them a special process. So that maybe they would do this at an increased distance.
I mean, what they did in South Korea, that anyone whose temperature was higher than 37.5 Celsius was led to a special booth where they did their voting. I mean, it's something we could learn from South Korea.
No, exactly so. That's the point I was raising, that there would have to be special considerations for people who have an elevated temperature. So for me, all the points that have been outlined, the hand washing, the sanitizer use, the social distancing, together with the mask use, will have to be enforced. But to promote these, a lot of these things would have to be provided for the citizenry,
by the state. By the state.
But for me, and maybe Evans, I would ask you to pose this question, because you would be able to do it much better. I would like to ask both Mr. Segbefi and Mr. Oppong-Nkrumah, that is there any line in the sand beyond which they would say, if the public health data suggests that this is going to put us at risk of X number of infections and Y number of deaths, is there a line that's in the sand beyond which they both agree that, look, we're not going to do this? And I'm just asking this as a public health professional, so that if there is no line in the sand, then we know that, okay, this is happening, it is by all means happening, and we've just got to make do with the best that we can. But if there's a line in the sand, I'd like to very much know from both sides if there is one. Actually, for my opinion, I wish there was, but I know it's a lot more complicated.
Mr. Oppong-Nkrumah, I want to go first on that question.
I think there could be a line in the sand dependent on what the science says. That is why, again, I make the point that the Electoral Commission, which is the independent body, has to quicken its work and give us some baseline to begin to work with. You see, we must strike a balance between trying to dictate to them and also being too aloof. And in the middle line, what needs to happen is that they also need to step up to the plate and share with us, for example, whether they have done any engagement with the science community and they have some basis to say that this is the line in the sand that we are not able to go beyond, and that is why we have to do X, Y, Z. In the absence of that, what we have is a constitutional provision that says the election must happen, and knowledge that we must adapt, and we'll just have to be waiting for them to explain to us how they plan to put in place some mitigation measures or steps. But I can clearly foresee we are in an era where we have had to impose restrictions on movement in Accra at some point, closure of our borders at some point, restrictions of movement for religious and academic activities. Why? Because at least the baseline science as we had it at the time, if you look at the positivity rates at the time, about 2% heading to about 3%, gave us cause to initially lock down and then take a decision that, well, if you look at what the data and the science is saying, you can open up if people can wear masks and protect themselves, and you will not get a positivity rate that should skyrocket way beyond 3 to 5% thereabout. If you are using an early surveillance method, you get asymptomatic people, and therefore your mortality rate is lower. That was based on the science. So I can foresee how some different change in the science can change something else. But that means that the Electoral Commission has to quicken its effort and tell us that this is what it is, this is what the baseline is, and therefore we act accordingly in this way or that way.
I'm going to take a quick break. When I come, I'll hear from Mr. Alex Egbefia, and then I'll ask the big question: campaigning towards the December 7 elections. If you take away the EC's role, etc., the parties themselves will have to do a number of things, outdooring their manifestos. NDC will still have to outdoor their running mate. There must be what we are accustomed to, political rallies. How will all that look like in the COVID-19 era? Stay with me. On the PM Express tonight with me, Information Minister Kojo Oppong-Nkrumah, Alex Egbefia, former Health Minister and a member of the NDC COVID-19 team, and Dr. Amoisi with the KCCR and KNUST. Let's talk about, Mr. Egbefia, we've had a lot of discussions tonight about the process leading into the December 7 elections, the EC, the registration, and how to make it safe, etc. But the parties themselves have their own internal things they need to do to win power, which is campaigning, which is outdooring, in your case, outdooring your running mate, seeking winning the hearts and minds of people. Normally you hold rallies. Normally you'll be doing a bit of the on-the-ground game. What is it going to look like for you? Is the party talking about this, and what are you thinking about it around this?
Well, we are definitely looking at it and seeing what means we can use to actually deal with the campaign as we move towards December. Forgive me if I'm not open and telling you what exactly we are going to do or how we're going to do it. I think that remains with us as an internal issue. Okay. Suffice it to say, there are certain milestones that we have to cross, so we will have to make sure that we outdoor running mate at some point, and we'll also have to outdoor our manifesto. And these are two major things for us.
Do I see a virtual rally for the NDC coming out?
Well, not necessarily. I think that we don't want to preempt anything, but we are all watching this space, because even if restrictions are lifted, we still have to ask ourselves, is this still safe to go out in numbers?
Yeah, that's a very important point.
If you go out in numbers and you're bringing your people, if they fall ill, technically it's your numbers that go down.
And they can't vote for you anyway. That's a good one. I mean, forgive me because of time. Could you? I have 30 seconds for you. Are you going to be campaigning your constituency, and what would it look like? Just 30 seconds, if you may.
No, I think that moving.
Sorry, Alex. Forgive me. Let me give Kojo the last 20 seconds.
Okay, sorry.
Kojo, yes.
Sorry, I didn't know that.
Are you gonna?
No, Alex's candidate has already been campaigning virtually while we've been busy dealing with COVID-19. But yes, we will campaign across the country, but we'll have to do it in a manner that doesn't put our candidates, the presidential candidates and other candidates, as well as our potential voters at risk. And we are already examining how to do that, assuming things stay the way they are through to the election period.
I'm grateful, Kojo. I'm grateful, Alex. I'm grateful, Dr. Amoisi. My name is Evans Smith. Enjoy the rest of you.